Hi, everybody. Happy Monday. Thank you for being here in person and online. Excited to see a couple faces in person that we normally don't get to. So glad you guys are here. And the ones we normally get to, we're excited for you too, Zoe. We have a packed agenda as always that we're going to run through. Lots of goodness to share. I think more people will be joining us online as we continue to move forward, but we are going to get started. Do we need to do introductions? I think we're good. Well, if you're speaking to us today, please introduce yourself and your role. But other than that, I think we all know each other. Hi. Oh, good to see you too. This is exciting. Our next agenda item is public comment.
No public comments.
No public comment in the room or online. So see how quickly we are doing this. So we are going to then move right into our Community Connect survey outcomes with Kisa and Katie. Kisa's online, so Kisa, we're going to send it right over to you.
Great, thank you so much. Hi, we haven't met, I'm Kisa Klonbeck. I'm the System Coordination Supervisor here at Washington County, she, her pronouns. Sorry for not being able to be in person today. I'm working with our regional partners on our regional coordinated entry work in person today. So hopefully we'll have some things to bring you related to that next month. So happy to share going into our Community Connect feedback survey. I think Nadia, you're controlling the slides. So next slide, please. So this is our provider results. We do this survey for both our providers who interact with our coordinated entry system, Community Connect, and for our participants. The goal for the provider side of our survey is to better understand how a variety of staff interact with our system and perceive how it's functioning. The audience was staff at all of our contracted provider agencies who interact with phase 1 assessments in some way. So that could be giving them, that could be accepting referrals for folks who have had a phase 1 assessment. It could be folks who just update assessments or check on them, anybody who interacted with them. It was open for responses from May 5th to May 18th. And we have taken previous action based on feedback from the survey. We've updated trainings, we've made policy changes, we've made assessment changes. So these results really do help us understand our system and put into action changes that folks would like to see. Next slide, please. So we received 26 total responses, over 12 agencies total. These are the provider responses by length of service. So we did see most of the responses were from folks who had been there between 1 and 3 years. This is kind of a neat reflection from last year where we had a lot of responses for folks who had been there 1 year or less. So I like to think that some of these results are because that some of the folks who were responding that they had been 1 year or less last year are maybe now responding in that 1 to 3 year category. Next slide, please. These are our responses by race and lived experience. So for the race, respondents may be in multiple categories for race and ethnicity. So the numbers and the percentages, the hard data doesn't quite match up to the percentages or the number of people. But this is the results. We did see an increase in representation this year from folks who identify as Hispanic, Latino, Latina, and the lived experience question was a new question. This was a question that the Solutions Council or HISN, I can't quite remember which one, recommended we add in this year. So this was the first time we've had the lived experience question, and really excited to see that a lot of our providers, a lot of the provider response was from folks who had either current or a history of lived experience of homelessness. So exciting to see that folks working in our system are bringing those experiences and understanding into their work in our system. Next slide, please.
We have 8% that are currently experiencing homelessness.
That was what they responded. I don't have additional information about that, but that indeed was what they reported. We didn't define unsheltered versus sheltered homelessness, so it could fall into a category of people who are doubled up or couch surfing. So we could add that further context next year if that would be helpful.
Yeah, that causes curiosity, that's the right word. Yeah, that causes curiosity.
Concern.
That word too. Because that's gonna go back to wages, right? And are we paying a living wage so people can move out of homelessness that are working in our system? Okay. Sorry, Kisa.
No, not at all. So these are, this is the response around, do folks feel that we have good interagency communications? We did see, so on the left-hand side, the good interagency communication, last year we saw 71% agree or strongly agree, and this year that moved to a 63%. So definitely something that we want to pay attention and be responsive to. The specific feedback around how folks in the disagree or strongly disagree category shared were requests for consistent types of communication for new policies or procedures from the county, an increased understanding of what services are provided with other agencies within the system, and then a desire for increased teamwork and communication between case managers at different agencies to provide a warmer handoff or better services for that participant that they might both be working with. So some things that were already working before the survey even happened that was sort of already in the works was including a warm handoff policy in our program manual for the next fiscal year. So ideally that will increase those interagency communications during points of transfer. So for participants who are going from shelter to housing or from outreach to shelter, that there'll be a little bit more overlap encouraged specifically in the contract for our providers. We also have a goal to create more digestible information on services provided across our continuum. So to make sure that that is available for all folks to truly deeply understand the continuum of services and which providers in our system are working on those areas. We're also streamlining how policies are rolled out and when, so limiting changes to quarterly at most and ensuring that we're sending a memo to all agencies when something changes, as well as documenting those in our program manual or HMIS documents that we can show exactly what has been updated so folks can also understand the timeline around that, but really trying to limit those changes and make them at consistent intervals. Next slide, please. So as far as our phase 1 assessments, in 2024, we had 65% of folks agree or strongly agree that assessments were accurate. This year, it bumped up slightly to 69% of respondents. So glad to see that there is a slight increase in how accurate folks feel like their phase 1 assessments are. Always room for more improvement there, though. Next slide, please. As far as provider response to our referrals that are coming into their agency, and this could be really for shelter referrals or any of our housing referrals, either way. We have 62% reporting that referrals are usually or always accurate. It's a slight increase of sometimes from last year, but not a huge increase. General feedback was participants with too high of needs were being referred to permanent supportive housing. Participants who could have been successful in rapid rehousing were referred into permanent supportive housing. Participants with shelter referrals who had resolved by the time that they were matched. And participants' eligibility at intake didn't match what was on their phase 1. So those are all just those elements that we continually think through of how to make referrals more accurate. As far as being able to contact referrals, that also held pretty steady, 46% saying yes, they could. The folks that responded said no were a little bit more complicated. They were the majority of the no responses where they shared more information was that they were able to contact them some percentage of the time. So it was more like I needed to add another response that was sometimes instead of yes or no. So not a straight no for that 27%. Next slide, please. Our provider responses around training, are folks receiving the appropriate level of training related to Community Connect? 73% agreed or strongly agreed. It's around the same percentage from last year. Training accessibility was a new question. Heartened to see that 85% felt like training was accessible. Obviously, still need to do work to address the 15%. We want everybody in our system to feel a larger majority to feel like training is accessible to them. Some training feedback were requested monthly trainings as optional, specifically related to HMIS, increasing HMIS training. We do have some action items around those, considering how we can do repurpose our HMIS office hours to maybe be a monthly training session. We have some new staff coming into our HMIS team and having them really support updating our training materials with sort of a fresh set of eyes. And then we always have encouraged providers, if there are specific pieces of our training materials that aren't lining up, please always feel free to reach out. It's always helpful to have those identified with fresh eyes, so we can get those materials updated. I did see a decrease in reported confusion about how matching works, which I think is great news, and I think might demonstrate that matching in case conferencing has had that intended effect of increasing the transparency of our system. So that piece made me feel hopeful. Oh, sorry. Yes, there's a question.
Hi, this is Rachel Duke with Community Partners for Affordable Housing, also chair of the Housing Organ, which is an organization of housing agencies. I have two questions, but really just one. Like, did you do any cross kind of analysis to look at the responses by race and ethnicity and lived experience, so that, for example, you could say of the 8% of people who are identifying as currently being homeless, do they fall into a particular demographic? Also, in terms of accessibility of training, do folks fall into a particular demographic? Because that seems like those are things that we might be interested in.
Absolutely. I did look at that anecdotally, and I don't have the numbers here because at some point the data becomes too granular to share without having concerns of being able to specifically identify folks. So I also wanted to be careful of that. We are only working with a data set of 26 people. I did look for that in the data without sharing it here, so we didn't have that concern around the granularity. And there was nothing that stood out as, for example, that our folks who had lived experience of homelessness were not overrepresented in folks who did not feel did feel they received appropriate levels of training. There wasn't anything that specifically stood out in those numbers.
And you look at the homelessness also, rates of home, just because it's so intense to have 8%, which is that like 4 or 5 people, 2 people?
Yeah, if you look at 8% of the 26 total, there were a couple folks that declined, but
okay.
Sorry, just doing the quick mental math on that. But yes, I did try to look to see if those connections existed, and from what I saw, the connections didn't, nothing stood out.
So it might be good. Oh, okay. Got it. Thank you. I'm good. I'm done with my fabulous recommendations.
Okay. Next slide, please. So general system improvements that folks shared were ability to view a wait list, increased accuracy of data entry, always a request for that, more training for folks completing phase 1 assessments, more specific understanding of how questions on the phase 1 directly relate to eligibility, decreased increased preparations with participants prior to housing referrals, such as document collection, increasing visibility in HMIS, ability to share more information with participants regarding wait times, and considering how participants are prioritized for medium-term versus long-term housing options. So just in relation to these, some projects in the works are conversations with regional partners to identify our common assessment questions, which can be aligned and simplified. So I think some folks have been, and specifically in our veterans and DV systems, have been pulled into some conversations around how can we better regionalize our coordinated entry assessments to make them a little bit more simple. And we are bringing we're making those we're seeing currently where those questions can align, and we'll be bringing some opportunities for feedback to our lived experience feedback groups and provider feedback groups in the coming months. So excited about that work. Conversations around prioritization changes will be happening in alignment with the work to update our local implementation plan, which is starting relatively soon. So there will be more opportunities to engage with how we make those updates to prioritization to best get people into the resources that fit their situation. We do have work underway to identify a new HMIS provider. I believe that's been chosen. I don't know how. I'm not going to go into detail because it's sort of out of my scope, but the excitement around it is that we will hopefully be able to have an HMIS system that is much more user-friendly, requires a lot less clicking around, and through that will increase the data quality. So that is still, a couple years off to get there, but it's certainly been identified that we need to move in a direction to have a provider that better fits our region's needs. Also considerations of how our phase 1 training can continue to be updated to meet the needs of our providers. That is always something that we are working towards. And then our regional HMIS governance committee is working towards approving visibility changes, which will, even in this current implementation of HMIS, hopefully increase visibility for all users. So these things have been in the works for a very long time, and we're just grateful that for our HMIS team for continuing to do that good work. Next slide, please. So the next piece is participant results. Next slide, please. So the survey was offered in a couple different ways for our participants. There was an online survey that's optimized for phone or tablet. That link could be sent to a participant, or a QR code could be scanned by a participant. We did have the paper form available. We had PDF flyers with scannable QR codes that were sent to all organizations who complete phase 1s. The survey and flyer were both translated into Spanish specifically. And if any other language requests came up, it was requested folks reach out, and we would extend the period of the survey to make sure we could get a survey translated into the requested language and include their response in the system. And then our online survey, if folks were completing it that way, most web-based browsers can update that immediately to translate into any other language or many other languages. Next slide, please. So we had 25 surveys total completed, 11 paper surveys, and 14 online surveys. We had 8 Spanish language surveys completed and 17 English surveys completed. This was really exciting because we have not actually had we haven't had paper surveys or Spanish language surveys utilized in the past. So I was really excited to get both of those responses. It felt like it meant that it was getting out to people that weren't connecting with other types of survey responses. There were increased responses from participants who completed a phase 1 with our partner agencies. So we've always seen a large representation of surveys coming back from the Community Connect phone line folks, or folks who completed it there, or folks who completed it at CAO, but really excited to see that a lot more responses were coming back from folks at other agencies as well. And for folks that were calling CAO or the Community Connect phone line, just a piece that all agreed or strongly agreed that their call was answered or returned within 24 hours. And next slide, please. This is the participant responses by race. Some participants were identified in multiple categories. And this is another area where, again, we saw increased responses from participants who identified as Hispanic, Latino, Latina. So excited that we again, we're getting some increased representation in our feedback survey this year. Next slide, please. As far as how the phase one was completed, the majority of folks either walked into a location and received the assessment at the same time or were asked to schedule an appointment. Everybody who was asked to schedule an appointment said that it was an easy process to schedule, and they didn't experience any or didn't report any barriers to scheduling and completing that assessment. Next slide, please. So additional resources provided, participants could choose multiple on the surveys. So folks were all, a majority of folks were given information about emergency shelter, housing programs, also information on 2-on-1, other included food banks, referrals to outreach, snacks, hygiene items. So most folks were given awareness at least of other resources within our system. Next slide, please. This one was really interesting. In 2024, we asked if folks, in 2024 and 2023, if folks had an understanding of their next steps after they completed their assessment. And it was somewhere, 53%, so about half said that they agreed or strongly agreed that they did understand their next steps. This time it hugely jumped up to 96%. So that was just a really interesting increase. From our, and I'm not sure, don't have a lot of explanation for that, but it is an interesting point that it increased this year. So all respondents either agreed or strongly agreed to the following questions. So I didn't make charts for them, but it was all agree or strongly agree. I understood what the questions meant. I understood why the questions were being asked, and I felt comfortably answering the questions honestly. Next slide. These are the participant response comments. So these are the open fields that folks shared. So a lot around being easy, folks being really nice and helpful and welcoming. And that was, again, just exciting to see and exciting to be able to reflect on the amazing staff that many of you have at your agencies. So those are those. Next slide, please. The next is around participant responses for improvements. So folks being, a lot around wanting more information around how long it takes to be placed, more concrete solutions, shorter wait time, instant housing. So all of those things are areas where I think all coordinated entry systems struggle by nature of what coordinated entry looks like. And I think there's some really great opportunities, especially as we engage with prioritization conversations in the context of our local implementation plan work, how we can consider giving more accurate information to participants and what we can make that look like within our system. So a lot of things to think about there. And the last note is a long comment, and so but I couldn't shorten it. It was I didn't want to shorten anyone's comment, and they needed a whole one. But I thought this comment was just a really amazing reflection of when the system works, and to get this person kind of through from staying in a hotel that they could no longer pay for with their child. Into a shelter where they've been able to stabilize, their mental health is stabilized, and starting to work on their career again. So taking this time in shelter to very deeply stabilize and hopefully be able to move on and into their own housing after this. So just a really great message, again, to show how amazing our providers really are and the great work that they do. So we do have a couple questions for you today as far as what's next. So one question is, how does this feedback from providers and participants support your understanding of coordinated entry and your advisement role on this committee? The next question is, do you have any questions or concerns for staff to address after receiving the overview of this feedback? I did include some other data links if those are ever helpful, our quarterly report, our annual report, and our point in time count. but I'm happy to chat through these questions or any other questions that are coming up for folks.
I have a quick question. For the provider survey, 26 response, I assume it went out to all the providers that are under contract with Washington County. And then do we have an idea of how many actual people do phase one assessments? Like what percentage of response did you get?
Yeah, the percentage of response was a lot lower this year, which I was, kind of sort of sad by it. Last year we had 53 responses and this year we had 26. It went out to everybody in our system who has HMIS access and is basically everybody that has HMI access and is an active HMIS user, because really everybody who is almost everyone who's an active HMIS user is also interacting with phase one assessments in some way. It wasn't just intended to focus on people who were doing the first time assessments, but if anybody was updating assessments, changing them, updating or doing assessments for the first time. It's a little bit hard to say how many people are doing that at each agency because each agency is different. We have around 200 trained folks who have trained to do the phase one assessment. How each agency utilizes those folks can look really different. Folks who have done, who are HCMS case managers, for example, have been through the phase one assessment training, but they may only be interacting with it insofar as when they receive a referral, they're sitting down with the participant and ensuring the information is correct on it. So it really varies on how they're doing those phase one assessments, or how each agency is using that training.
Thanks.
Yeah, please.
I think, this is Rachel Duke again. I think that the biggest, there's some really good information in here, and the place where it seems like there's some work to be done is on the appropriateness of referrals. That continues to be a problem. And in particular, I know from just listening to my colleagues talk that appropriate referrals into rapid rehousing, making sure that those really are people who need rapid rehousing and not more intensive services is a really big deal. And then finding ways to best use rapid rehousing, which can be a very powerful tool for a quicker in and out with someone to stabilize them before they get to a place where they need more stuff. So I feel like that is one place where probably there's some work to be done. I'm curious, if there's what you guys have been talking about in terms of that, or maybe that's a different meeting, but I'm sure you've been thinking about it.
Is that a question for this room or me specifically? Sorry.
Whoever wants to answer it, I don't care. I'm agnostic on that.
I can take this.
Okay, thanks, Katie.
Washington County, we are having conversations about rapid, more to come for sure. I think that's there was a slight shift in November to not have chronic referrals go to rapid rehousing, and recognizing that that wasn't the most successful. I think one of the things that we are referencing is how we've implemented rapid rehousing in Washington County, and really continuing to look at that. I think Ridgely brought some really good points during contract conversations about your utility reimbursement or rapid rehousing, and tying that to specifically to zero income households. And so I think definitely more to come. I don't know if necessarily coordinated entry, I think Community Connect, and as I think the space that as we go into years 6 through 10 of the local implementation plan, coordinated entry will be impacted through that, and really starting to get at who are we trying to solve homelessness for. But I think, I don't know if necessarily the phase one is going to shift. The implementation of phase one is going to change who goes into rapid rehousing. So probably not exactly a conversation in response to this presentation, but definitely something that's on the table.
Drew?
Hi, Drew Williamson. I work with Boys and Girls Aid. I think the eye opener for me is really just like the lack of faith in the interagency communication. And I'm just wondering kind of where that shows up and thinking about what we can do to help with that. And I can't, I'm just wondering if any of that, there's just so many parts of the system that really rely on really great communication between agencies, and the faith that each other, each of us are doing our part to make sure things are up to date and accurate and timely. And I just wonder if there's anything we can do to help strengthen relationships between one another. I think that would likely help with communication if we're like, working towards ensuring people know who other people are and know who to contact. And I think oftentimes people are more likely to reach out and to facilitate, that good communication if they have a relationship with somebody within an agency. And so just wondering if there's work we could do there.
Well, this brings up the question for me about the ability to do internal referrals.
Is that the opposite of what Drew's offering?
I don't know that it's the opposite. It's for us, I guess I can only speak for us, so I guess I'm switching hats right now. Because we have the multiple programs that could streamline it for someone, outreach, access center, shelter, housing. And we build those relationships instead of having to do a warm handoff to somebody they don't know, just allowing us to continue that process for them to get them to that success story. Doesn't have to be 100% internal referrals, but the ability to do that sometimes. I think there is opportunity for more partnership. I also, as egotistical as this is gonna sound, PHC kills it. I mean, this is what we do. We build a relationship. And we have great relationship with many of our partners, and it's still a struggle, but sometimes that's client, not agencies.
That makes sense.
One of the things that, as Zoe from Community Action, one of the things that I have noticed is that we put on the client the ability to be in contact with the coordinated entry and be placed either a program or in shelter. And, it may pass 30, 60 days when they are matched to any of these resources, and agencies are unable to have a success engagement with the participant. And they remain homeless. We just lost them. So I don't know if we have considered asking a question during the assessment, if we want to be the ones contacting them and reminding if they want to be on the wait list, instead of saying, don't forget you need to call us, otherwise you're going to be out of the wait list. And then all of a sudden they see others, because there is a community, that they get placed in any of these resources when they are thinking they are on the wait list. But somebody else is either making that call for them, an outreach worker, or they have a fund, but not everybody is doing it. And then we are creating that gap of people still remaining homeless and now being chronically homeless who are not connect. And I know it's capacity, but I feel like we can adjust something in that we are the ones who are reaching out and making sure they are still connected and to the end, to a shelter placement or to a housing program placement. So we don't have that gap. And
He said, can you talk a little bit about our inactive policy? Our team goes through and Hannah does all the manual inactivity in our system. So if you're touching anybody in our system, it keeps you active with community or with our coordinated entry system. Kisa, can you talk a little bit about what keeps you active and what makes you inactive in the process Hannah goes through?
Yeah, definitely. I mean, it really is any interaction with our coordinated, or sorry, with our system in general, or any of our providers that are utilizing our system. So if they're showing up at PHC's Day Center, if they are recorded at Just Compassion Safe Parking, they are continuing to be active in our system. And I know one thing that the at least on the phone line side, and maybe this is room for, further conversation, but they're great at sending referrals to for folks who are experiencing, in particular, unsheltered homelessness, referrals to the street outreach team to help keep folks connected. I think that is the hope that would continue to be a connecting point too, is with our access centers and our street outreach teams, to really meaningfully keep people engaged. Because yes, Zoe, to your point, the capacity is a challenge to call everyone on our coordinated entry list.
Yeah, and I'm saying this because from our shelter, we have rooms empty for a long time when we get referrals that are not, the weekend contracted participants. So, and then I know that we have, request more referrals, but still, we would like to fill those rooms, no more than 3 days. Having them empty for 3-4 weeks.
Oh, can you describe, Zoe, what is in the active policy causing that 3 to 4 week delay?
So you get a referral, we get 3 referrals, we call them, and they're not phone is disconnected, or they already fixed their situation, which is good. And then we need more referrals.
So it's almost that people stay active, too many people stay active when they're not actually active.
Exactly.
And
But
3
we-
referrals
I-
isn't enough
Yeah.
to get to an actual person ready for shelter. Thank you.
What's the right number of referrals?
He's like, correct me if I'm wrong, but it's 3.
No, how many, like,
No, what would you want? What would be ideal?
Oh, I don't know.
I think it's different for singles
Yeah.
versus families, and I think this is where we need to probably do some, he said, feel free to correct me if I'm wrong, but I think we are, people are calling in too much rather than just utilizing the system and being in contact with the system, so that people keep calling back Community Connect and saying, hey, I still need to be on the wait list, and they've resolved their homelessness, and so we're actually over assessing folks into Community Connect and into shelter when folks did self-resolve and that's one of the challenges of our shelter waitlist and our housing waitlist is people are self-resolving faster than we are staying in contact with them. So people keep calling back, and then we end up having, specifically on the family side, because because we have a shelter waitlist, they self-resolve before coming to the top of the shelter waitlist.
so what's the right, but like, would you double it? Should you do 6 referrals
We
instead
have-
of 3?
Yeah.
I mean, we have the same problem in housing, right? Like when we have a unit available in a building, you have to give people a certain amount of time to respond, but if you only have, you want to make sure you have, it's always a balancing act to make sure that you give people the time they need to respond, but also that you're not holding a valuable resource, vacant too long.
This is, I'm gonna jump in here really quickly. This is something Kisa has actually started describing for me as sort of a pool of getting ready folks. So everybody can be on the list, but then there's a smaller list of people who are close to the top and are sort of being helped to be exactly ready for the day that the call comes. And that way you don't fall off the list. But when you're sort of like in the time to get ready, then it's a little bit more a quality list for the providers to make those more solid connections. I'm sorry, Kisa, I'm not using the right terminology, but I know that you've described this as a possible system improvement that could come along in our coordinated entry kind of fix.
You're next on the list, make sure you will get the call soon, that's our responsibility. So they don't stay on also, the uncertainty.
Do you guys have a timeline for when that, or is that just something that you guys started talking about?
That's, sorry, Jess, definitely a new conversation, I think, for us, and like the very early stages of it. It is something that Clackamas County and Multnomah County have looked at and implemented in different ways that are applicable to their county. But that definitely, I think it's a conversation that we need a lot of feedback from our providers, from our community, to make sure we implement it well for our community. But it's generally referred to as a priority pool that you create based on the anticipated number of housing openings, predicted housing openings over the next 6, 8, 12 months, depending on what you decide. So it requires a significant data lift of doing that prediction, right, of how many openings we'd have. But then, yes, the focus of that list would be around ensuring that they're ready to go for housing. It has the benefit of giving some participants who are on the wait list a little bit more clarity on how long it will take them to get matched. It obviously doesn't solve for everyone on the wait list in terms of timing, but for a group of participants, it can be. I found it to be, other areas have found it to be a more trauma-informed way to give folks an idea of how long it might take to access housing resources.
Hey, Vernon.
Hello. Just wanted to add to the process. Just some concerns about getting multiple referrals, especially at our shelter, when the acuity level is sufficiently above our capacity, basically to deal with this. We get people aren't really even closely appropriate for a congregate shelter. And then with the way our shelter is set up, then having making difficult decisions in terms of what we're doing with those individuals, and multiple EMT calls, and people are just being in vulnerable situations and somewhat compromising. And it puts a real stress and strain on our staffing structure based on those kind of consistent referrals that are being sent to us.
Any other questions or comments? Martin? Kisa, thank you for joining us. Thank you for your presentation.
Thank you.
Okay, as always, staff are always available for any follow-up questions or comments you have later that come to mind. So just email them if something comes up. Our next agenda item is our rehousing and policy information with Katie.
All. Do you want to go to the next slide? So a memo was sent out attached to your packet. Yep. Okay, great. Want to spend some time talking about rehousing. I know this has been a conversation specifically around budget reductions and as we manage our system. So I think I'll quickly run through slides, but really want to spend a lot of this conversation talking about the discussion questions. We have guiding principles that have been kind of at the center of SHS since we launched in part of our program manual. Really looking at how do we support individuals through the work. So housing first, really leaning into kind of our work around housing first, harm reduction, trauma-informed care, progressive engagement, and centering race equity. All of these are described in detail in the memo, but happy to answer questions as we dive into this, while simultaneously managing accountability. So if we go to the next slide, we have program expectations of making sure that we have an individualized case management plan for every single person in our housing programs. We do program transfers for as progressive engagement is needed into a higher level of programming or a different level of programming, depending on what works for the individual. And then program termination. This is something that is kind of updating with this fiscal year, as well as kind of has not necessarily the connection between terminating someone's ARLA voucher with terminating somebody from a program. So bringing that closer together, I think I want to just like name that and call that out is we haven't always terminated somebody from their ARLA voucher even when programs have terminated folks, and really making sure that we're also following the participants' commitment when they sign their ARLA guidance. So paying their rent is required. There's a lot of things that we terminate folks for, but we should also be terminating from the ARLA voucher program and recognizing that. And so want to spend some time kind of talking through how we balance these two different competing factors of program expectations with also having somebody experiencing homelessness at the center of all of our programming. And so if we want to go to the next slide, we'll spend some time talking through some of these discussion questions. I think one of the things that we're trying to get to with our policy is at what point are we giving somebody too many chances and we don't have endless funding to continuously rehouse participants. I think we've continuously had feedback shared with us that you all said to just keep housing folks, and that isn't actually the best thing for the participant or the landlord or the program. And so how do we balance these two different competing factors of housing first with accountability? And then how do we balance kind of the budget restrictions of continuously giving folks chances while also recognizing that we have a wait list and a lot of people who still haven't been housed for the first time, and we don't have an endless budget that can continue to house folks over and over again, especially when they're not in alignment with the program standards that they signed when they signed on to being a participant of ARLA. So things like, I'm going to pay my rent and I'm going to pay my participant portion. Things like, I'm going to abide by my lease and not break lease violations of having 10 dogs or visitors or other things. And so want to just pause and kind of give chances for feedback, and then we'll go through implementation questions too.
Just quick question. What are the most common reasons for exiting someone from a program?
On the ARLA side or on the program?
How about both? And then why are there differences between the two?
Up until this year, we had I would say on the ARLA side, it's typically lease violations that end up in dangerous situations. So not just I had 10 dogs in my apartment, but rather I had violence in my apartment, things like that, that really kind of are escalated. I think oftentimes our ARLA team in our housing department isn't always notified of all of the lease violations that happen. And so it's a lot longer for them to terminate comparatively to programs. So we're working to bring that closer together and make sure that kind of those two things are talking to each other. And we're actually rolling out a smart sheet. Supervisors heard about it this morning, but recognizing that we need to kind of bring those closer together. I would say on the program side, it tends to be more about behavior. So behavior towards staff, and then often up until actually still currently and come 7/1, we're really trying to eliminate people could get terminated from program their provider up to 3 times and get passed to a different provider. And oftentimes what I've realized in evaluating those terminations is we probably should have been evaluating it for an ARLA termination and not just a provider termination.
Can you define housing first for me?
Housing first is a number of things. So first and foremost, we are somebody does not have to be housing ready, so they do not. They can come in with substance use, mental health, whatever that may be, but we also need to provide those wraparound services to be able to not only pay their rent, but also support them with the services needed. It's looking at, I think one of the things that is often interchangeable with housing first is how are we respecting somebody's choice while also doing harm reduction. So somebody is, if somebody is choosing to make decisions, we have to support those decisions and not say you are not ready for housing because of those decisions, while also encouraging good decisions like paying rent and not engaging in risky behavior, but we are not offering housing because of that risky behavior.
But then we're gonna kick them out for those risky behaviors.
I think everybody still has person-centered choice. And so when you agree to sign a lease, you are held to the same standard as anybody else who signs a lease. So if we are not kicking you out because you, if you choose to not pay your rent, that is still a person-centered choice.
Well, hold on, can I just finish my thought? It's gonna be long. So just walk me through this, because these are the barriers that we're hitting, is we know someone is not housing ready, right? Their mental health is through the roof, and it could be because of addiction or vice versa. We're still putting them into housing, and then there's shock and awe when it's not working. But we don't have the wraparound services, as Housing First would define, for addiction and mental health in the real way. And I can't expect my case managers to be a mental health professional and an addiction specialist. That is not the expectation that has been set. And we just don't have those supports. As a region, as a state, we don't have those supports. And then now we're saying, oh, but we're going to penalize you and exit you because you can't follow the behaviors of a tenant that we said at the beginning we can't hold you harmless for. So I'm just wondering, where are we going to intersect? If we're going to not make sure people are housing ready to have success, and we're still going to put them into housing, can we get the appropriate wraparound services connected to it so that they have a higher level of success? So that we're not exiting people back to the street, because that feels like just a system that I don't want to play in. That's just not what we signed up for. That's not our intention, right? Is it not to put someone into housing and then go, cool, not working, we're gonna go ahead and exit you back to the street, which is what we're currently doing. We're building exit boxes. Let's put you back on the street, and here's all the tools that you can have while we figure out resources to hopefully get you housing ready, so that there is some success. So I'm trying to understand what's the shift 4 years in that we can make so that we aren't doing this, and we throw around Housing First really easily when I'm not sure that that's actually the model that we're doing.
Especially like, how do you navigate client autonomy with your decision making? Because one of the core principles of Housing First is that they get to choose what services that they engage in. So go ahead.
No, I was gonna say, I feel like I've been doing Housing First work for a couple decades because I'm an OG in this work, and in Portland anyway. And housing, I think that supportive housing works for some people, but it only works if you have those services. And the problem is those services come from other systems. They're not homeless services. They're services that the state's supposed to be paying for through other systems. And so when people say the system is broken, it makes me feel like I want to scream, because it's not about that. The other systems aren't delivering to do the work they're supposed to do. And we also need and the other problem is that not everyone, I know this is hearsay, but I'm just gonna say not everyone should be going into a permanent housing responsible for their lease. We need other kinds of shelters, not shelter, but like assisted living, or some things with rules, because folks aren't always ready to sign a lease. And we don't have those things either. And so we've created a system, and I think Housing First is excellent for some people. But we've created a system that is literally the only tool we have. And we don't have those other systems to come in and do the work they're supposed to do, so the people living in that housing can be successful. And then it makes it look like we can't do our job because we only have this one tool. It's really effed up.
I just want to interject here and say thank you. This is the conversation we want to have with you all. This is where we find ourselves at this crossroads here, especially now as we transition into a system of attrition only in our capacity. We've spent 4 years saying, let's try to get everybody housed. And now we're not going to have that capacity, and we're going to have to make harder decisions. And a lot of the people we've housed, you've housed, your staff have housed, are unfortunately not succeeding. And then what? What's our commitment to them? This is the rehousing question. And also, it's really expensive to keep trying the same thing, especially when the same thing isn't resulting in different outcomes for the individuals we're trying to help. So, but how do we make system level policies that guide good practices so that people aren't inadvertently being deemed unready for housing? We give people a chance, but also system-wide policies that don't continuously spend, scarce resources with ineffective outcomes. And that's the sandbox we want to play in with you all, is like, we have to make a policy that puts guide rails, and it's not going to be perfect, but we need some guide rails, and we don't think our guide rails right now are tuned correctly to the needs in our community. So how would you do that?
Is that a rhetorical question?
Yeah, that's what we want to hear, your thoughts.
No, it's not rhetorical.
Actual question.
I mean, I think the other thing that's getting all complicated now is we're gonna have all these bizarre key performance indicators floating from down from Metro that are not gonna be really connected to the work that we're doing or really understand. It's a very hard place to be. I do think that there are some ways you can house folks who are in active use where they can be safe. But it takes a different kind of model than like a traditional 100% supportive housing building. I just, and I feel Vernon when he says he's got a bunch of folks coming into his community, his shelter where it's not safe. It's not safe for everyone, for those folks to be there. We have to come up with other models. I think we need to come up with some other model. Like, I'm really glad to see the county doing the transitional housing for substance use disorder. Super stoked about that. I think that's going to be really helpful. We need a lot of that.
Yeah, I mean, when you look at the goals and the vision and the KPIs that President Peterson is putting forward, behavioral health is mentioned once. I mean, and so my pushback was, this is actually key to all of this work. To meet any of these goals, we actually need to get into the weeds of this mental health addiction stuff. I don't. Can I ask it's not a dumb question, I don't want to say that. Now that we're, a chunk of years in and been doing all of this, there's an inclination for like, can we serve less but serve them well? And is there funding available, because we can't rely on the state and we haven't had success with some of the, we need more resources for mental health and addiction. Could we pour funding into that to make sure that we're actually doing those wraparound services for those that are getting housed, that come in with challenges?
If we use local funds, and I'll be quiet, if we use local funds for that, we lose so much money because the Medicaid funds are matched.
Right.
And we want those federal matched dollars. So we have to really continue to put a lot of pressure on the state to deliver the services they're supposed to deliver.
Okay. Yeah, and you can talk all you want, don't.
Oh, well, Hannah's got it.
Oh yeah, Hannah, please.
Okay, I have a question. It's out of for clarification. So the question is, how do you get, what are program expectations? Are program expectations the leave? Or is that the participation in the program that is being offered at the what exactly do you mean by that? Can you be a little more?
Yeah, Nadia, can you go back a slide? Yeah, go ahead.
So I guess where I just kind of run into this is Housing First is no barrier to engage in housing. However, Housing First is not a program expectation. They have the autonomy to make the decisions on whether or not to engage in programs and engage in all of that. So I think that's just kind of where I run into, where it's yes, you have to follow lease rules, however, but does the lease require them to engage in these programs to live there? How are we require, or how do you see requiring somebody to engage in a program when the sole purpose and the core principles of Housing First is person autonomy?
Yeah, I think I can first answer, and then happy to have more discussion around the table too. But I don't think anything from Housing First Housing First doesn't say that you can still not abide by your lease though. And so that's a lot of the like barriers that we see here is like, up until even currently, and like one of the things that's shifting 7-1 is we allowed people to break their lease over and over and over and over again, and there was no accountability to that. Well, so it's not saying like now you have to engage in services, however, those services are gonna help you better engage with your lease and like abide by those rules, and so I think that's where that individual case management plan looks like. It's continuing from a services standpoint, continuing to make the effort to engage, but also then holding the accountability of like, you're breaking your lease over and over again. And up to this point, I think there's been a disconnect between Arla, we're continuing to pay rent over and over again while still not, and like people are getting kicked out of their apartments over and over again. I mean, I've heard stories of people rehousing 4, 5, 6 times for the same lease violations and never having hard, like I think we're trying to have hard conversations, but we're continuing to pay for the release and pay for the security deposit and lease people up again. And I think that is not in alignment with Arla guidance or like the participant agreements that somebody's signing on to.
I just feel like it's not housing first if we're making them do things like outside of lease agreements. Like lease agreements, there's processes and things like that. Like that is part of living there, but like the program side of it, I get it. I've gone back and forth like a long time ago, not a long time ago, a couple years ago, Burgess was like, we're housing first. And it's like, no, we're not housing first. We're, because there is program expectations that people have to follow. There is mentor case management. There is all of those things that they have to do to live there. Therefore, that doesn't translate to housing first.
I think that's true. I think there are some people where it is really just about the lease, and those are folks who are appropriate for housing first, and you don't have to be sober to be able to live, to be able to hold on to a lease. I think that's, but maybe some people do. Like it depends on the person. What's going on for them. And so it may be that if you're somebody who needs to be sober in order to abide by your lease, that housing first is not going to be a great fit for you, that what you need is treated housing and the capacity to participate in that. So I agree with what you're saying, that the folks who are in the housing first program, it is a voluntary, services are voluntary. You can't require somebody to participate in services. But if somebody, it is an art, and I know that if Catherine were here, who does this work at SEPA, she would say it's the same thing you're saying. You can't call it housing first and then require someone to participate in case management. But her team is going to offer that over and over again in a really assertive way, and hopefully eventually that person is going to participate. And if they don't, and if they keep breaking their lease, then probably that's not a great program for them. And I guess the question is, how many times do we have to figure that out? Right?
Yeah.
And I absolutely like the studies. Oh, sorry.
No, I guess one clarification I want to add is Arla participant agreements don't say you have to be engaging with case management, but it is saying you can't continuously break your lease. You can't have destructive behavior toward, or like flagrant or violent behavior towards staff. So it's like, it's not saying just so I didn't talk to my case manager and therefore I'm getting kicked out of Arla.
Okay.
When was the last time that like the policies were updated?
Prior to they're getting updated 7-1.
Oh, okay.
They're next week. All of everybody's staff in here are like waiting for it.
What was the nature, like what were you hoping for?
Well, I'm just thinking like if that could be a requirement. I know services are voluntary, but would there be a way to like embed that as a requirement within the policy?
Engagement in services. I would love to hear people's thoughts on that.
No, we need different models. We need some models where you require participation and you need, and then housing first, it should be a narrower band. Like we should be able to not just have this blunt instrument that we try to use to solve every problem for every person. There are some people for whom housing first is great, and there are a lot of people also for whom it is not. And we don't get to make a lot of choices because we don't have very many alternatives.
Our intention was not to put on the table the question of should we be housing first. It was more of trying to hone in on the rehousing. How many times does our system tell a case manager, tell a provider, you must rehouse this person again, even though the behaviors, the outcomes have consistently been negative? Because right now, it's my understanding, our system requires the case manager to continue rehousing that household and continue paying for those living costs. And Kim, I'm just gonna use your little tool and take my hat off and say, when I was a case manager, I used to have to write appeal letters and reasonable accommodation letters and sign off and attesting to my confidence that the household would be successful in housing. Do your case managers still have to do that today? Is that how you get people housed?
I mean, as an organization that receives those for much of our housing, but not the homeless services necessarily, yes, like we would expect if somebody was going through a reasonable accommodation process to get into like a regular affordable housing unit that wasn't necessarily supportive housing, or in some cases supportive housing, we would expect to know that person, the case manager assumed and thought that person was going to be successful.
And so are case managers able to not write that letter on behalf of a participant if they aren't confident they will be like, how does housing first conflict with?
I mean, that's the question, back to Katie's point earlier, the narrative has been keep them housed, keep them housed, keep them housed. And I know at PHC, my particularly management level for the past couple of years have been like, what the heck? Because we have a lot of lived experience, and they're like, I had to hustle to get to my situation, to get into housing and stuff. And we're just keep paying rent, even though somebody's, not following the lease or doing destructive behavior, all the things. And so this has been top of mind for us is where is that tension? Where is that line? And, but again, I know the question wasn't about housing first, but we throw it around really easily. So it gets confusing because we also have clients that are very savvy and also can go like, whoa, this is supposed to be housing first. You can't actually do that to me. And it's like, well, but actually we are going to have some guidelines here, guys, because it's necessary for you to be, sustainable. And so my first thought to answer the question would be a maximum number of times, and then dictating length. Because we rehouse some people in 3 times in 9 months. Whereas if the program told us, well, no, you can only rehouse once a year, maximum of this many years over a 10-year span or something.
Yes, but counterpoint, like I think as a system operator, it's our job to create guide rails, but not to implement the program, make those decisions. So we want you to have we want you to have the expertise, the freedom to leverage your expertise to make the decision that's right for the household that you're serving inside of guiding principles and parameters. So I don't know that we should say you can only rehouse once a year, because what if that's not actually what's the best outcome for that?
So then clarification, because then this goes back to this housing first. Viren, I do see your hand, hold on a sec. This whole housing first thing, like we have many clients that we know are not housing ready, but they've got an ARLA voucher. And we're like, wow, this is gonna suck. But yet we're being told house them. Or back to, I think it was somebody's point about rapid rehousing. We're being told like, put them in, and we're like, this is not going to be the program for them. They can't do it. Or moving out of PSH and being asked to be put in HCMS. Like it just, there's components that are happening where we want to have that authority to be like, this is not going to work, but then we're getting the pushback going, no, put them in. So I agree with you, but that's not what's happening on the ground in some ways. So I get, if I had a question is, then can we have that same autonomy at the beginning when someone's coming and wants to be housed and all indicators, not just a feeling, it's not, but all indicators say this person is not ready to be housed. Housing first would tell us that we house them. And that's, I think that's part of the struggle is, what we're seeing today, the heart rate we're seeing today is we've housed people and now they're going back to the street, and that is cry-worthy. Vernon, sir.
Yes, thank you. To that point, I know, just you say we're not talking about housing first, but a lot of this is interrelated in that, I cringed over the last year and a half when I see how many times we're spending money on situations where ultimately we kind of knew they weren't going to work. And those are resources that could have went somewhere else. And then also, when we look at our report cards and what the metrics we're being asked to meet, a lot of times, I don't want to say compromising, but in a way we are to get to those places where we're putting people in positions that we kind of know that ultimately they're going to fail or recidivate out. And so I think it's really important for us to look at, having something else as an option. Housing first is great. I heard that. I'm not saying it's not, but some of our people, a lot of our guests that we're seeing at Just Compassion, is that even on their best situations, they're not ready. But yet and still, we're still pushing them forward because that's the expectation.
Hey, Stacy, do you want to say more about your comment? I think it's a good one.
Stacy might not be able to because she's dialed in. Can't be
got it,
promoted to
got it.
panelist. Yeah.
So agency would have an escalation process, and that's what we would take said client through versus defining a number of times that we would rehouse.
Rehousing. So
Yeah.
once they.
Right.
I understand that as we house them, but then the second time it would be an escalated.
Yeah. Yeah.
You've maybe now gone through Rentwell or
Right.
some other process as you are rehousing or we're paying for the rehousing.
Or when they changed agencies because they didn't fit with one agency, it didn't fit with an agency, and then got out with another agency.
So a great point. One of the things you'll see revisited in the program manual is transfers and termination. So I think a lot of the times, a lot of those transfers that you've seen have been like a program termination. And so really we're looking at like, is that termination still, should we be terminating? Should we be transferring instead of terminating? And what does that really look like? I think in our policies currently, somebody can get terminated 3 times from 3 different programs. And that is something that we've really evaluated and heard a lot of feedback that that's really problematic when somebody really should have just been terminated from the program and not necessarily just transferred to the next program too.
It sounds like every program is using a different escalation pathway though, and a different like process and like for some people, they may get 15 opportunities to make the same mistake before anything were to happen. Like I wonder if the process isn't necessarily standardizing a number of times, but standardizing kind of the process that somebody has to go through, that an organization would have to go through to do an exit.
Or have a panel of like a retention, I don't know, a retention panel and discuss cases with different entities or staff.
As you'll all see, I really love this approach. Stacy, thank you for putting out a solution-oriented idea for us. You'll see in the program manual a lot of reference to the program operator must have a grievance policy on file, and it must include these parameters. And every year the county may check to make sure your grievance policy is up to date, and if there are too many grievances, we might inquire. And I can imagine having a similar kind of container here, like have a policy that works for your programmatic implementation, and we have some parameters on that, what should be included in that policy, but each organization can implement that policy according to their best practices.
So I also just want to remind us that it's hard to fully evaluate the efficacy of housing first and supportive housing when we don't always have the system pieces in place that are actually necessary. So we're having multiple conversations at once. And so it may be that sometimes people are not doing well in housing, in a permanent housing with a lease, because they're just not doing well. There's not much, they just can't. They really need something different. And it may be that that's not the case. It may be that they could do well if actually they were getting the substance use treatment or the mental health services they needed to stay in place. But they made an appointment 6 months ago with a psychiatrist. They just haven't been able to get their appointment yet. And then, getting a follow-up appointment, like it's very, very hard to get those mental health appointments. I will also say that our site-based programs are different than our scattered site programs. And like at the Joyce or at Heartwood Commons, right? There's a lot more tolerance for some things than there might be if you're in an apartment building where there's hardly anyone else who has the same kinds of struggles. And I think we also might think about that sometimes. And when we're doing this work, that there may be that there are some folks who are just going to do better, just simply because they're just behaviors tolerated sometimes in those buildings that may not be tolerated elsewhere. So those are all, there's just like a lot of things to be thinking about. And it is really hard to come up with one defining rule. But what is true is we need more supportive services that come from other systems. And we need more strategies and models for housing, like bridges to change or other transitional kinds of housing. And I also think we need to treat families a little bit different than we treat single adults. It's very destabilizing for families to have to keep moving and moving. And so whatever we can do to keep families in one place feels really important.
And to add on that, training, we got a participant that have been released from other agencies for behavior and stuff. And talking to the case manager, so far, success. Like sometimes there are participants that, the ones that are willing to engage, the ones that, they are having their check-ins. And what has been successful with this case management? Why this person has success engaging and then helping this participant to have success in the housing that others couldn't. There's also training for engagement to work on, let's review your leads, let's see how we can make this better and make it more intense if needed and if they're allowed.
Can I ask a clarifying question, Katie? Because did we get off track here?
We did get a little bit off track, but we are also out of time.
But just clarify for me, so you are gonna present a rehousing policy introduction. That's not included in the program manual that's gonna be going out next week?
Correct.
It's not included.
It is not included.
Okay, so you didn't even get to your slides. Is that what I'm?
But that's okay. I think we got a lot of discussion out of this.
Well, this is just going back to a point that we discuss a lot in our debriefs is not making our agenda so heavy because this group is really thoughtful and experienced and we get into deep discussions. And we only gave you 20 minutes and it's been almost 45. So it's just, again, proving to me that we need to shift our agenda. So that's just we'll talk. Did you want to go, what would you like, I don't know what to do next.
No, I think this discussion was really helpful. I think there's some things that will come forward with the program manual. I think there's also things that as we figure out budgets for 25, 26, this is going to be really impactful with budgets. So happy to have further discussions with individuals. Feel free to reach out to me and we can continue this discussion. We are going to be coming back to you in the future for more conversation about this. But I also know that there is some really important staff updates and legislative updates.
Yeah, but you have this rehousing policy. You have a different group that's meeting that people can join, right?
We do not yet have a group, but we will.
I thought it was Thursday. What's Thursday?
That's for homeless prevention.
Okay, well, good luck. So you'll come back. We'll continue this conversation.
I'll do a focus group on rehousing policy is what
Turns out.
I'm hearing Tim say.
One more focus group for the fun of okay, is Carly still here?
Yes.
Carly, hi, so sorry about that. Thank you for being here. We would love your legislative updates.
Hi, everyone. Hello, Chair Marshall, members of the committee. For the record, my name is Carly Silva Gabrielson, and I'm one of the government relations managers with Washington County. For the interest of time, I'm going to be pretty quick and just say that I look forward to returning with the end of session, post-session update on all of the accomplishments in the legislature and things that we need to work on next time. There's a lot of really great information on the slide, so I'm going to let you digest that, and I'm always happy to take follow-up questions via email. But I did just want to highlight that the constitutional sine die for the legislature to end is this Sunday, the 29th. So we have a lot of work yet to do this week. Tomorrow, we're going to see in the Joint Subcommittee on Capital Construction work sessions on 2 bills that are very important to our agenda, SB 5505 and SB 5531, which will provide different fundings for components that will support affordable housing in terms of preservation, lift rental housing, the program, and funding for permanent supportive housing programs. So I want to give Molly some opportunity at the end of this meeting to get to her slides. So I think I'm just going to pause there. And again, I welcome any questions via email, and I look forward to returning hopefully in July or August for that post-session update. But thank you all for your work and the great partnership. And Molly, I'll turn it over to you. Next slide, please.
Oh dear, I didn't realize you guys were using my picture. So this is that. We can pull the slide back down. How about that? I can just show myself. Molly in real time.
I think you're wearing a shirt in both. Yeah.
Can you guys see me okay?
Yes.
Okay. I'm here to really, actually, seriously, we can take that slide down. Be great. Thank you. Oh, there's more staffing updates, but mainly I'm here. I really wanted to just acknowledge that there's been a number of federal issues as well as all the things you guys have been managing. Actually, I would love to just see everyone's faces if that's okay. Maybe I need to. There we go. Okay. And mainly we as you guys have all know, we've been facing a series of executive orders really since day one. And the key sort of attacks are related to our asking communities, forcing communities to pull back on our principles of diversity, equity, and inclusion, and climate change. So what has happened, we've been watching these very closely, but I wanted to recognize there's been an uptick in some exposure and issues the company has been facing more recently. And that's because some of our grant agreements are facing renewals or are new, having us sign new agreements. And there's now new language tied to these agreements and attestations that are forcing us to say, yes, we will agree with all of the executive orders, and we will agree that none of this funding will support DEI. We can't support climate change. There's now new language that we won't promote what they call gender ideology. There's even language around abortion. There's language around not being able to support illegal immigrants. And it is really in conflict with how the county interprets its own equity policies and the work that we're doing. So as some of you may be aware, we had the board look at this and realize that we had a very blanket and a very broad equity statement that was applying across the whole county. So the board right now has not moved forward with making any changes at this time, but they're looking very seriously at making some adjustments and amendments to our equity statement so that they are actually will not conflict with what we're reading as our executive orders and these additional, what we call attestations that HUD and the federal government is making us sign. Right now, our legal counsel is advising we don't sign any federal grants right now that force us to put our board and our staff essentially at risk of saying that we're doing something that we're not. What we're hearing now is the board is seeking consultation with ACRE, so our advisory committee on race and diversity and inclusion. And they spent some time this weekend even going through next steps, and they're spending more time with staff this week, mainly legal counsel, as well as the whole county administrative office is really looking into how do we navigate through these really challenging waters of wanting to proceed and continue all the great federal work that we're doing, but we want to do it in a way that is informed by our folks who are directly affected, and of course our partners in our equity work, which does not feel good, and that's been hearing loud and clear. We need to figure out how we do this and navigate through our values. But what we have heard is right now there is a pause on assigning all federal grants. And I just want you to all know and just hear from me that that's $135 million in the county that funds multiple departments. For us, that funds our continuum of care. It funds our housing choice voucher and our special purpose voucher. It funds the Office of Community Development, that's CDBG and Home, and also the Emergency Shelter Grant, and also public housing. Now, these attestations are coming out sort of one at a time, and I just wanted to let you know that that Washington, that there is a whole series of certain words that were being cross-tabbed. They're essentially all these counties and all these cities are going with an AI platform, and we're being cross-tabbed, and we were put on a list that we were not in compliance with executive orders. A few weeks ago, that list was published. It was then revoked just a few days later. So we don't quite know at this stage how we're being viewed by the administration in terms of our compliance with EOs. Right now, our board and our staff are taking it very seriously to identify where we feel like we need to modify some language so that we can eventually move forward with our federal funds. I wish I had more information. There's a lot of stuff we don't know yet. This is all in real time, happening very quickly. And so we just wanted to quickly get to you all as well to let you know that we're hoping to figure out how we get our federal programs flowing as soon as possible. And with that, I actually just want to turn over to Jess so she can talk about the specifics to the continuum of care.
I'll be very brief. Our whole grant has been sent to us that we renew on an annual basis with the federal government, the grant agreement. And we don't yet have direction from our board on how to handle that. And because of that, there are 2 contracted providers in our COC program that aren't going to have a timely contract in place for their July 1 renewal. So I'll be calling them today to talk with them about this. Every indication from our board and our county leadership is we're solving for how do we do both, uphold our values and continue the critical funding with these federal resources. I hope, and Molly is, we're trying to convey our hope is that this is just a delay until we can figure out those details. But there's not a lot more that we know. And Molly, the room is heavy with this information, and I just want you all to know we hear that heaviness, we feel that heaviness. This is a really hard time in the county right now.
Can I propose? This could have been handled so differently. And that's part of the struggle for me is I understand the predicament we've been put in by these executive orders and the amount of money that's on the line and the partners that are going to be affected by it and ultimately the clients. I am fully okay with that. And I think that we could have potentially come to a better resolution utilizing the partners and all of those had this not been a last minute agenda item on the Board of County Commissioners, had it not been presented to any of the partners ahead of time, staff knew, use your solutions council. Hey, this is coming. This is a conversation that's being had, and there is going to be emotions. There is going to be chaos. How do we mitigate it versus what happened? Pause happened because enough people advocated just for a pause. My advocacy was not to not sign or not to make a shift. I think we do need to make a shift. Do I think we need to just remove the equity statement? No. Do we need to change some language? Absolutely. Does it ultimately not change the work we do? No, it doesn't. We're still going to do the good work and we're still going to serve our clients appropriately. And I can shift my language, use words like access instead of equity. Happy to. But it's again how it was handled that when we talk about mistrust or frustrations, we could have solved this together so that it would have been an agenda item that got resolved appropriate timing so that you guys can move forward. So we hit that July 1 deadline and those agencies are not going to have to be affected.
Should I, Molly, would you like to take that comment or would you like me to?
We do. Yeah, we're not going to be here and disagree. And there's a lot of ways we need to navigate this going forward. And what we're trying to do is bring real-time information of how the programs are going to be affected, how are there different ways we could navigate this, ways that we can, then the board the board and CIO has essentially more time to work with our providers, to work with you all, to work with us. So that's what I'm hearing, that there's more about, there was going to be more of a delay, but now we're hearing, we're not sure quite how much longer they're going to really feel like they need to work with folks to get to your point. Nothing's going to change in terms of the way we're committing to DEI, the way we're wanting to work with our community partners. We have to revise some language around that. And we need more time, frankly, to really understand the impact. And that's what we're all, just here we are in partnership saying, yep, we do need more time with you.
Is this an agenda item for tomorrow's commissioner meeting? Correct, right?
I believe so.
Yeah.
It was this morning. Has that been changed, Molly?
What was the question?
Is this on the board's agenda tomorrow, this item?
No, I'm hearing it's no longer on the agenda now. They want more time even. They don't know when they're going to bring it back.
Okay, thank you. Sorry about that.
Didn't they have some town halls or something this weekend?
They had a retreat with the ACRE committee. So this is all county. Really, the Department of Housing Services is following the direction of county leadership on this part. And it just so happens that we are one of the grant recipients that is getting caught up in this chaos. We had no idea this was coming down the pike the last time we met as a Solutions Council, just to clarify. This has all been very quickly happening. Lots of weekend legal coordination calls to figure it out. We were on 3 different calls already this morning to figure out what we could say publicly today here because we wanted to alert you all and be as transparent as possible. So ACRE is the advisory body, the Advisory Committee on Racial Equity that is being convened to met as a retreat, and I'm assuming is going to be a part of that continued conversation with our board and county leadership about what we do about this.
We will update you as soon as we are updating ourselves to get through this, because we have right now there's a lot at stake. And unfortunately, we didn't have enough time here I really appreciate the conversation around housing first. I just wanted to elevate that this is, that it's this metaphor of how do we, I just think about 20 years of thinking about us serving folks not worried about their eviction status, and then thinking about how do we now get people in, how many chances do you give folks? that's the kind of core work we need to keep working with you on. We need to make sure the federal funds can continue to flow and that no one is feeling like they have to violate an executive order. So we will come back. We will definitely come back to you on this because we have to get this resolved so we can keep doing the housing work and that you're all doing.
Thank you, Molly.
Thanks, Molly.
Thanks, Molly. Okay, guys, we are a little bit over time, but I would love to get to the staff and committee updates because I know that there's things. So staff, do you want to start, and then we'll move to committees that folks sit on.
Yes, and I think Jess is taking the updates this time. We'll get that slide pulled back up. But Jess, if you want to.
I'll proceed very quickly. Congratulations to our partners at Project Homeless Connect who won the RFP to be our future and ongoing operator of the new Hillsborough shelter. We're really excited to have that project come online, and thank you for your your bravery in moving forward as that operator. This slide I think is generally about some RFP updates. So one update is yay to PHC. Another update is that our Cornell recovery housing RFP is still coming online.
July 7th.
Very soon. Wow, amazing. And we've been talking to you all about the pod villages. You know that they're in 2 different locations, 30 sites or 30 pods at each site that were temporarily located. I said this in a meeting with Kim last week. I'm saying it as often as I can. We're still looking. If you have any ideas, we need to identify a viable site for more permanent. We're no longer saying permanent, more permanent than 2 years. We hope it to be permanent, but we're at the point where we're going to have to make some compromise decisions to make sure we can keep these 60 pods in operation. And so we have that RFP for long-term operator on hold until we can identify a viable site. I don't know what that next meeting is about.
Next Solutions Council.
Oh.
Yes.
Team, do you want to take it from there?
Yeah, it's going to be on July 17th. We're going to be talking about health and housing integration and homeless prevention. And if there's any carryover from this meeting that we want to bring back, Kim, we can discuss it.
Mm-hmm. And I think we have just one more slide to give an opportunity to talk about any updates for committees you all are in. And I know, Rachel, before the meeting started, you had offered to give an update, which it's not listed, but the Metro Council President SHS work group.
So it's over. We had our last meeting. That's an important update. The last 2 meetings, one was really focused on key performance indicators, also known as KPIs. There were many proposed KPIs. And so I did point out that staff actually can't spend all their time tracking KPIs because they won't have any time to do the work. But I was in a small group with Lynn Peterson and Mayor Joe Buck, who's the mayor of Lake Oswego, and they did not, I'm not sure they heard me fully, but, and then the last meeting was about governance, and the governance model that's currently being proposed, if I may editorialize a tiny bit, I think is a little bit confusing and is very process heavy and involves a lot of people that maybe, it's gonna be a big investment. And I hope it can get slimmed down. So I don't know, about a few months ago, Nicholas Kristof wrote an article about how process heavy Portland and other states on the West Coast are, and this is just an example of that. And it certainly is one way that Metro will be able to spend their entire administrative what they collect for admin. So it's a lot, and I'm hoping that there'll be feedback that it's too much, but I don't know. So those are my brief updates. I think now we also know that it's not going on the ballot. We didn't really talk about that at the meeting, but it sounded like the polling wasn't great. And so I think that's the discussion for the moment with SHS, but I'm only 89% sure of that. And we'll see what happens. I think that Metro President Peterson believes that if Metro proposes a governance process that feels like it's going to hold us more accountable, that voters will be more likely to support it.
because we have.
Zoe, do you wanna do, is it TCPB?
Yeah, we review our quarterly progress report for our main goals, coordinated entry, land recruitment, and CSA ecosystem. We also review the update of the council president and review all of the great ideas. Yeah, part of that work group. And thank you. A voice with lots of knowledge.
Abel, would you like to do McKinney-Vento?
Sure. Abel Garcia Gomez, Elohim, McKinney-Vento liaison for Hillsborough, foster care point of contact for the same district. The McKinney-Vento network met with our community partners on June 5th. It was kind of requested by a lot of our partners, actually, just with all the executive orders going on. The biggest takeaway from that meeting was the sudden closure of the Astoria Job Corps Center, which actually supports a lot of unaccompanied youth in the state. And so it was approximately, I think, over 300 students were forced to exit Job Corps. The other thing too is May 30th, the current presidential administration proposed gave additional information on their budget proposal, and it includes the complete elimination of the McKinney-Vento Act's EHCY, which is the Homeless Children and Youth Funding. So it's education for homeless and children and youth, and so it's created a lot of stress for not just the McKinney-Vento liaisons here in this state, but all around the country. And so we're just keeping an eye on that. We're out for the summer, but preliminary numbers, across the county, initial ones for the schools. Hillsborough, it looks like we're ending our school year with 632 McKinney-Vento qualified, about 66%, so 418 of those are doubled up. 136 students were unsheltered or in substandard situations. Beaverton School District ended the school year with 2,033 McKinney-Vento students. 231 of those were unaccompanied youth. And even smaller districts, for example, Forest Grove had 126 students, Sherwood had 100 students. So numbers decreased a little bit compared to last school year, but still way, way larger than they were before pandemic numbers. So that's where we're at as a county right now. We'll have more details probably around like September, October. And then we usually present to Hessen come around November, December.
Do you know where the kids from Hutton Point Job Corps went to?
So a lot of those kids ended up just going back home, those without homes. My understanding is that different organizations were like rallying to help find places. I know the city of Astoria had a really good connection with Hutton Point in particular, and so a lot of that community was rallying around the center. But yeah, it was really heartbreaking to hear that news.
Did lived experience meet in between? Is Hannah? Is Hannah still here?
They met at the end of May, but I was in Florida for a drug court conference.
Yeah, we met, and we had, oh gosh, I forget their name.
Focus strategies. Oh, focus strategies.
Yes, there we go. They were mostly doing a focus group that was related to the Metro SHS project and getting like feedback related to that. We have notes which we can share out, I think. I'll see if there's an official, when they're planning on sharing their like official report. But this is one of a few that they're speaking to, one of a few groups.
And maybe for a bit more context, this is related to what Zoe was uplifting around the Tri-County Planning Body. One of the goals for the landlord recruitment and retention was investigating mission-driven property management. So they were talking with lived experience groups about what is needed to live into the mission for property management.
And they got Mark Dolan, which just makes me jealous. And Mandy. Man, good meeting to be in. Cool. Am I missing any other? Yeah.
So June 30, we're passing, American is passing the emergency rent assistance delivery, because we don't have funding, or that which is the state fund has not yet been, decided or released. We don't have SHS anymore for prevention. So we're closing our lines, passing our lines, expecting, whatever rent assistance pass. So we're gonna see probably more, people on addiction, COVID because of that. And we still have like heat, so encourage your community and your, participants to contact community action for utility assistance. We still have utility assistance. But figure that light heat also pass, and
That is bad news. That is, oh.
It's like this meeting's too much.
Hopefully I'm staff. Oh, I'm sorry. Well. Yeah.
Yeah.
So, so then this is the opportunity to get outside and enjoy some sunshine. This is the opportunity to make sure that you're doing some sort of self-care while you're doing this really, really hard, heavy work that continues to get harder and heavier, as, well, I'm just gonna say it, as this administration, continues, and it doesn't diminish the good work that's being done. There's really, really good life-changing work being done. This funding, this SHS funding has been life-changing for people, and we need to live in that space a little bit longer to recognize the goodness that is happening, even through the hard. I am a crier, so I'm gonna cry, because it's just too dang hard. And I'm housed, so it's so thank you for being here. Thank you for going over time. We will see you in July. Reach out to staff with any questions that you might have or follow up. Yeah, we'll see you next month. Bye, guys.
oh my gosh.